Attention men over 50. If you have stopped having regular sexual relations, this video is for you. Do you feel less vital, less motivated, or do you notice certain aches and weaknesses that weren't there before? Today we are going to talk about a topic that most men avoid, but which is crucial for masculine health, longevity, and vigor after 50. I am Dr. Richard Powell, and in this video, we are going to reveal what happens to your body when you stop sexual activity and why maintaining function is vital. We are not here to judge, but to give you the scientific truth and the tools to keep your health in peak condition. Stay until the end, because we are going to detail the 3 biggest consequences of non-use and how you can reverse them naturally. Before we start, I want to know if you have noticed a change in your energy or general health after a period of inactivity. Leave your comment below and feel free to ask any questions about this important topic. And of course, do not forget to subscribe to the channel and activate notifications so you do not miss any men's health tips. First, we need to talk about prostate health and the risk of stagnation. Among many factors that affect the prostate, the frequency of ejaculation has been the subject of important studies, and you need to understand the facts. But how exactly does regular sexual activity or the lack of it affect this vital organ in older men? Let us delve into this. Stagnation of fluids is a growing concern. The prostate is a gland designed to produce seminal fluids for the body, and non-use can lead to stagnation. Studies suggest that men who maintain a higher ejaculatory frequency tend to have a lower risk of certain prostatic conditions. Ejaculation works as a natural cleansing mechanism. It removes old cells and potentially inflammatory substances that can accumulate in the gland over time. The inclusion of regular ejaculatory activity supports this natural cleansing system, helping to maintain prostatic cellular health proactively. How semen release helps with inflammation management. Chronic inflammation is a major cause of health problems as we age. Research suggests that regular release can have a protective effect. Epidemiological studies indicate that a higher frequency of ejaculation may be associated with a reduced risk of prostate cancer. Although diet and genetics are primary factors, maintaining function can be an ally in inflammatory control. Non-use can lead to an accumulation of fluids and cells, resulting in more inflammation and discomfort. Maintaining frequency helps ensure that the prostate ducts remain unobstructed and functional. This can alleviate the risk of non-infectious prostatitis or tissue swelling in the region. Sexual activity supports the nervous system in the pelvic area. When levels are low, the nerve signals that control urination and erection can become slower. Regular ejaculation helps protect nerve health by promoting communication between the brain and the pelvic muscles. It improves the tone of the nerves and muscles that control the bladder and erectile function. It prevents the risk of neuropathy-related dysfunctions, which are common in older men. Maintaining regular function supports nerve integrity, reducing the faulty signals that lead to problems. Older men are more susceptible to prostate problems with low B12 and poor circulation in the area, and how sexual activity can help. Yes, reduced circulation and vitamin deficiencies can exacerbate muscle and nerve weakness in the pelvis. Certain medications or lifestyle habits can affect the absorption of important nutrients. Low frequency of physical or sexual activity can reduce blood flow and oxygenation in the area. Non-use can cause weakness and stiffness in the pelvic floor, and sphincters leading to incontinence or erection problems. Sexual activity maintains blood flow in the region, providing more oxygen and nutrients to the muscles and nerves. Although diet and supplementation are essential, maintaining pelvic function through activity helps ensure the area is regularly exercised and vascularized. How many times a week should ejaculation occur to support prostate health without increasing concerns? Observational studies suggest that a frequency of at least 3 to 5 times a week can be beneficial for the prevention of certain prostate conditions. For most healthy men, maintaining this frequency is safe and can be an ally of prostate health. However, for those with heart conditions or other concerns, consultation with a cardiologist or urologist is recommended. Replacing sedentary habits with regular activity can be a healthy choice for the prostate. Can nighttime sexual activity reduce other common problems in the elderly, such as pain or stiffness? Yes. Muscle relaxation. The release of endorphins during climax and improved blood flow can help. Activity provides a natural exercise for the pelvic muscles. It supports muscle recovery throughout the night, reducing morning stiffness. It relieves nerve and muscle tension that contributes to stress and pain. Including activity during the week can help balance the body and support nighttime recovery, reducing cramps and aches. Certain men may need adjustments in frequency based on health conditions. Those with cardiovascular disease should maintain a doctor-approved exercise routine. Men with high cholesterol should focus on a healthy diet to maximize vascular benefits. For most older men, regular sexual activity is a powerful ally that supports the prostate nerve function and overall health. Second essential point, the loss of firmness and the risk of fibrosis. Maintaining erectile function is similar to maintaining any muscle in the body. When you stop using that tissue, it weakens. Non-use is the enemy of function. Men over 50 are more prone to erection problems due to vascular or nerve factors. Sexual activity is an essential vascular exercise. But what exactly happens when men stop having erections or stop activity? Similar to the deterioration of a hose that is not used. Nighttime and morning erections are important for the oxygenation of the cavernous bodies. The lack of regular erections leads to prolonged periods of low oxygenation in the penile tissue. This can cause the replacement of elastic muscle tissue with less flexible fibrous tissue. Erectile tissue needs oxygen-rich blood, and the absence of erections leads to unwanted stiffness. Fibrosis hinders the penis's ability to expand completely during erection, resulting in loss of firmness and functional size. Maintaining regular erection through stimulation or activity helps preserve the elasticity and health of the tissue. Nitric oxide is the master chemical of erections. It signals the relaxation of blood vessels, allowing blood to flow into the cavernous bodies. Regular sexual activity or stimulation supports the continuous production of nitric oxide. It helps maintain the functionality of endothelial cells, the internal lining of the blood vessels. It reduces the risk of endothelial dysfunction, which is a common precursor to erectile dysfunction. For men over 50 seeking to maintain firmness, regular stimulation helps ensure that the nitric oxide system remains responsive. What is the impact of inactivity on hormone levels, and how does this affect libido? Testosterone is the key hormone for libido, bone density, and mood. Non-use of sexual function can lead to a drop in libido, which creates a vicious cycle of inactivity. Sexual activity and orgasm can induce the release of testosterone and prolactin. Inactivity can signal the body that reproductive function is not a priority, resulting in a decline in desire. A 2018 study suggested that men who maintain sexual activity tend to report better mood and energy levels. Maintaining activity supports hormonal health and psychological well-being. It is vital to use the function. Third and crucial, the decline in mood and mental well-being. While the physical problems are clear, the impact on mental well-being after inactivity is profound. Sexual activity is a powerful hormonal and emotional regulator. How the lack of activity impacts stress and sleep. Sex and orgasm release oxytocin, the feel-good hormone, and endorphins, the natural chemicals for happiness. The absence of these hormonal releases leaves the body more vulnerable to stress and anxiety. Inactivity can lead to an increase in cortisol levels, the stress hormone. Oxytocin induces relaxation and improves sleep quality. For older men, sexual activity can be a natural therapy against stress, promoting deeper, more restorative sleep by reducing muscle and mental tension. Maintaining satisfaction in intimate life is crucial for self-esteem. When function declines or is abandoned, many men feel less masculine and less confident. Regular sexual activity reinforces masculine identity and self-esteem. It helps maintain physical intimacy with the partner, strengthening the relationship, which is a source of emotional support. It reduces the feeling of isolation or failure that often accompanies erectile dysfunction. For longevity, social connection and sexual satisfaction go hand in hand. Men who maintain a satisfying sex life tend to have a better quality of life and a sharper mental focus. Brain function also benefits. Sexual activity stimulates cerebral circulation and the release of hormones that support cognitive function. In summary, non-use after 50 is not just a loss of pleasure, it is a biological risk. Risk of prostate stagnation and inflammation. Risk of fibrosis and loss of firmness in erectile tissue. Risk of hormonal decline and worsening mental health. To counteract non-use, you need to maintain 3 pillars: regular activity, a diet rich in circulatory nutrients, and stress management. If you liked this content, please click the like button. Help us bring vital men's health information to more men. Leave your comment below and tell us what you thought or what topics we should address next. Do not forget to subscribe to receive our health insights. Stay informed, stay vital, and we will see you in the next video.